The objective of today's webinar is to introduce you to the different types of patient assistance resources that one would find on the NeedyMeds website. Who is NeedyMeds? We are a national nonprofit organization. We were founded in the mid-90s by a retired physician, Dr. Richard Sagel, who's our current president, and a medical social worker. They discovered patient assistance programs and they thought every patient and every prescriber should know about them. And so since this was the mid-90s and the internet was becoming a major source of information, they thought it made sense to create a website. So that's what they did. And it began with just a handful of patient assistance programs. We are considered an informational resource. So through our website and our toll-free helpline, we connect patients to programs that will provide financial assistance for healthcare costs, including medications, but beyond medications. We do not offer financial assistance, but we refer patients to programs that do. And currently, about 1.3 million people use our website every year. And this includes patients, family members, healthcare professionals, patient advocates, social workers, community healthcare workers, and so on. So as I mentioned, our website began with just a handful of patient assistance programs, but today we have about 7,000 points of savings on our website. And they'll range from programs that will provide free medicines and coupons to discounted imaging services. All the information on our website is accessible at no cost, and you'll never have to register for this information. We're not going to ask you to create a username and password or to give us your email address. So you can remain completely anonymous. And basically, you're going to find all of the financial assistance programs in one place on the NeedyMeds website, and that is the Patient Savings tab, which I'll show you in just a moment. There's a strategy to looking for patient assistance on the NeedyMeds website. The first place you want to look are the prescription assistance programs. The second place you want to look are the diagnosis-based assistance programs. Those two sections will have the greatest financial savings for patients. In other words, you'll either get free or deeply discounted medicines, services, supplies, and so on. Once you look through the PAPs and the DBAs, the next place you want to look would be coupons. And then you'd also want to see what savings you could get with our drug discount card. We have a few other resources on our website as well, which I'll point out to you very briefly. But as I mentioned, you want to start by looking for PAPs because you'll get the greatest savings with a PAP. For those of you who are new to NeedyMeds or new to this area, PAPs are prescription assistance programs. And these are programs that are sponsored by pharmaceutical manufacturers. These will provide free or deeply discounted medications to people that qualify. There's no law requiring a pharmaceutical company to have a PAP. So each company will do its own thing. And not every drug will have a PAP program. Eligibility requirements will vary from program to program. Application processes and the timing of those application processes will vary from program to program. There's really no common thread except for the fact that a patient's healthcare provider needs to be involved. And that means providing a valid prescription for the medication and signing the PAP application. Some of these programs will help people who are uninsured. Others will help people that have insurance but perhaps do not have drug coverage. And other programs will help people who have drug coverage but perhaps cannot afford their copayments. So as I said, it varies from program to program. And where can you find more information about PAPs? Well, that's where the NeedyMeds website comes into play. So here's our website. I'll make the screen larger for you. If you were looking for a PAP, you could do it in one of two ways. The first is that you could simply type the name of your medication into the drug search box and then click on drug search, and it would pull up all the PAPs that are currently available for that particular medication. The second way, as I mentioned, is to go to where we keep all of our financial assistance resources, and that is the Patient Savings tab. The Patient Savings tab, as I said, is where you'll find the PAPs, the diagnosis-based assistance programs, coupons, rebates, and more, and a few other resources that I'll touch on as well in our presentation. But let's continue our discussion of PAPs. So let's say I wanted to find Abilify. Abilify is a brand name drug, so I will click on brand name. I would click on A, scroll down, and here's Abilify. And if you look right under the word Abilify, you'll see that there's a scissors icon. And the scissors icon indicates that we currently have a coupon available for that. So you can click on this link, and it will take you to the manufacturer's coupon. And this may be of value if, for example, you or your patient are in a jam and you need the medication right away. A PAP application would take a few weeks to be processed, but you could immediately print out the coupon and then bring that to the pharmacy and get a discount. So keep that in mind if you're ever in a tough spot. Where it says View CR article, CR stands for Consumer Reports. We are very proud to have a partnership with Consumer Reports, and they've allowed us to put information about medications on our website. So here's an article discussing antipsychotic drugs, and it mentions Abilify, and that may be of interest to you or your patients. But let's click on Abilify. Currently, we have one PAP available. If we had more than one PAP, we would put the programs that provide the greatest assistance at the top of the list and programs that provide lesser assistance toward the bottom. But today, we just have one for Abilify. So here is where you'll see the name of the Patient Assistance Program. It's the Bristol Myers Squibb Patient Assistance Foundation, sponsored by Bristol Myers Squibb. If you have any questions about the application process or the eligibility requirements, you'd want to contact the Bristol Myers Squibb Patient Assistance Foundation using their toll-free helpline and ask them directly. Whereas NeedyMeds is the informational resource or the yellow pages of PAP programs, it's best to ask questions about the application to the pharmaceutical companies directly. Here you'll see we have an active PDF link for the application, which you can complete online and print out and get ready for your prescriber's signature. The medication section will tell you which medications are covered in this program. In this case, you have an oral solution as well as tablets. The eligibility requirements are perhaps the most important section of this application process. Often, income requirements are based on a certain multiple of the federal poverty level. So in this case, Bristol Myers Squibb wants to help people who live at or below 250% of the federal poverty level. Well, what does that mean in dollars and cents? If you click on the FPL income calculator, and let's say we have a family with a yearly income of $51,000, it's a family of 3 people, we calculate and we can see that this family is at 253% of the federal poverty level. And as you'll recall, Bristol Myers Squibb wants to help families at or below 250% of the federal poverty level. So in this case, we're just 3 percentage points over the income limit. Don't give up just yet. What we would recommend is to call Bristol Myers Squibb Patient Assistance Foundation and ask them to make an economic hardship exception for you. There's some subjectivity involved in the approval process of these applications. And if you're just a few percentage points over, maybe even 10 percentage points over, they have the authority to make exceptions for people. So make a phone call, and if you don't get the answer you like the first time, Dr. Sagal would always recommend calling back later that day or perhaps the next day and speaking with a different person who perhaps might look more favorably on your application. And as I mentioned before, not every medication will have a PAP. And if that's the case, if you're looking for help with a medication that does not currently have a PAP, It's always good to call the drug company and ask them to make an economic hardship exception for you. They can and do this quite regularly. And if your application is denied, appeal it. There's always an appeal process, whether it's completing a form or having your doctor write a letter, or perhaps you would write a letter yourself. Whatever the appeal process is, it's always worth the time, because they often do say yes to appeals. And I don't think a lot of people are using their right to an appeal. So I encourage you to do so. Scrolling down, you'll see in the application section, it will tell you how the application can be obtained and how you can return it. And it'll also tell you the decision time frame. In this case, it's within a week. You always want to give yourself between, I'd say, 3 to 4 weeks from the time you apply to a program until the time you receive your medication. So keep that in mind when you're planning your renewals for these applications. And when would you plan for a renewal? In the medication section, you'll see it says reapplication. This will tell you how often you have to reapply to this program. And in this particular case, they want you to apply once every year. So you want to mark that on your calendar as well, or put that in your patient's chart. And again, keep in mind it can take a few weeks from start to finish. So make sure you do keep abreast of these deadlines. One thing we would also recommend against is printing out stacks of applications and holding on to them. Even if you use the same application for yourself or for your patients, you always want to work off of an application off the website each time you apply to the program for yourself or for your patient, because these programs change all the time. New programs open, programs close, the eligibility requirements change, the application process changes, and if you return an outdated application, they won't process it. They will deny your application and ask you to reapply, and you'll cost yourself time. And you don't want to do that. So make sure you get a fresh application off the web each time you apply for yourself or for your patients. Scrolling back up and clicking on the Patient Savings tab, you'll notice that you can also search for a PAP for a generic medication. And I'll just point out to you that NeedyMeds has partnered with RX Outreach to fund a program that will provide free generic medications to people that qualify. If the generic medication you're looking for is part of this select group of medications, you'll find it just by searching for the generic name of your drug. If, however, you wanted to see the complete list of drugs we are currently offering for free to people that qualify, you could search for the name of the program. And the name of our program is called the Generic Assistance Program. So I would click on Program Name List, select G, scroll down, and here we see Generic Assistance Program. And again, you'll see here it's sponsored by NeedyMeds and RX Outreach. We are currently fundraising to expand this fund for people. These are the medications that we're currently providing assistance with. We've particularly selected generic medications that can be quite expensive for people, and some people won't have access to them. And so that's why they've been selected to be on this list. But as I said, we're fundraising, and the more money we raise means the more people we can help, and also the more drugs we can include on this list. So again, this is like any other PAP application. You would apply, and we're allowing one request per patient. So again, I found that by going under the program name list, or you can simply search for the generic name of the medication you're seeking. You can also search for the name of the pharmaceutical company that makes your drug, and you can look for programs that way. Just wanted to point out something new at NeedyMeds. Here you'll see a $4 generic discount drug programs. This is a national directory of discounted drug programs at pharmacy retailers. So for example, if I wanted to see all of the programs in the state of Georgia, there are currently 21. These are generic medications that range between $4 and $15, usually for a 30-day supply. And you'll see that they're alphabetized. from Costco and CVS to Rite Aid and Sam's Club. And a little known fact, you do not have to be a member of Costco to use their pharmacy. Um, so if you ever needed to pay the cash price for Costco, you could check out their pharmacy prices as well. They put them on their website, actually. So that's new at NeedyMeds. Some of these applications for PAPs can be complicated, and if you or your patients are having difficulty, um, you can look at the Help with Prescription Assistance application section right here. And this is a national directory of organizations that will help people apply to these programs for free or a discounted fee. So for example, in the state of Iowa, there are 106 programs that we know of. There may be more, but this is what we know so far. Run out of local nonprofits who will help people apply to these programs, who will help them complete the paperwork and gather the appropriate documents. So you can send a patient here if you don't have time to help them yourself, or if you are a patient or a family member of a patient, you can look at this directory and find programs in your community that may be able to help you. If you know of a program that's not currently listed, please let us know. We want the website to be as up-to-date as possible, so you can send us an email if you know of any programs not currently listed. Back to the Patient Savings tab, I'll just let you know that underneath that section, you'll see we have a section for free and low-cost clinics across the country. We have them divided between medical clinics and dental clinics. And you can search by state or you can search by zip code. So for a medical clinic, for example, if I wanted to see all the clinics in Massachusetts, we currently have 257 free or low-cost clinics. We give you a map to its location, a link to the website, the address and telephone number, the eligibility for who they'll see at this clinic, how you would pay, hours of service, and also what languages are spoken. You'll also notice that it will tell you what services are provided. This is where you'll find clinics that will do STD testing or women's health services and so on. So you may want to check this out. And if you have a patient who doesn't have insurance or has limited insurance, this may be a good option for them as well. And again, we encourage you to pay attention to the dental clinic section because even if you do have health insurance, it often does not include dental care. So this may be a good option for you or your patients. I also mentioned that we have a coupon section, and this is another way that patients can save money. Here you'll find coupons, rebates, free samples, and so on. And this is for prescription medicines as well as over-the-counter medicines and supplies. You can search by the name of your product, or you can search by a category. So if I search for, let's say, category, and I want to see everything available for diabetes, you'll see we have a listing of coupons related to diabetic testing strips and monitors and so on. So the other major way that a patient might find financial assistance would be to look at the diagnosis-based assistance section. First, I'll just let you know that the disease information pages will provide general information about a particular condition or disease, and will also list, for example, links to the PAPs that are currently open for medications related to that condition, and also suggested terms that you could search on the website. But the diagnosis-based assistance section is a place where you'll find a lot of help. You'll find a few copay cards and perhaps also assistance for the cost of medications, but this is where you're going to find help with things like wigs for chemotherapy patients, testing, supplies, house cleaning services, transportation services, help with insurance premiums and co-pays, and so on. So if you want to search, for example, for cancer, you can search for cancer in general, and it will pull up a listing of nonprofits that will provide assistance for various expenses related to cancer. We list programs that have a national area of service first, and then after the national programs, you'll see we have them alphabetized by state. So this is for cancer in general, but you can also search for a particular type of cancer. So going back to searching by a diagnosis, I could search under B for breast cancer. I could search C for cervical cancer. I could search P for prostate cancer, and so on. So we encourage you to look at these resources as well. And we cross-post diagnosis-based assistance programs with our government programs as well. So where there might be a federal program that will provide free breast cancer screening, we've got that listed in the breast cancer diagnosis section as well as the government program section. So you won't miss it if you searched in one place but not the other. So again, you can search by your diagnosis, or you can search by your state or the name of the program if you already know it. Under that, you may also be pleased to know that we have a directory of camps and retreats listed by diagnosis. For example, if you wanted to see camps for children with ADD or ADHD, we list them first by programs that accept campers from all over the country, and then by state. And again, you can search for all kinds of diagnoses and conditions. You could also search by the name of the camp or the camp location or the camp sponsor. And the same is true of scholarships. So for example, if you wanted to see if we had scholarships relating to people with, let's say, blindness. We currently have 16 scholarships for blindness, either people who are living with blindness or people who have a family member with blindness. So this is another little resource that you can check out as well. And as I already mentioned, we have a directory of government-funded programs. This is where you'll find federal programs, state, county level programs. And as I mentioned, it is cross-posted with diagnosis-based assistance when the program helps a specific condition or disease. This is also where you're going to see, all of our SHIP sites are located in this directory as well. And we also have the PACE sites. PACE is the acronym that means Program of All-Inclusive Care for the Elderly. It's a Medicare and Medicaid program that will help people meet their health care needs while living at home, so they don't have to live in a nursing home. And you'll find that listed here by state as well. We've also included federal poverty guidelines, a more in-depth explanation of them, and also a tax return request form for your convenience, because that's often required when applying to these programs. Underneath that, you'll see we have additional resources as well. HealFunder is a medical crowdfunding platform. This is new at NeedyMeds. We recently designed this last year. It's like Kickstarter or Indiegogo, except that it's exclusively for medical expenses, either expenses that have already been incurred, like a huge medical bill, or perhaps something that a patient is saving up for. Organizations can also use this platform for their fundraisers as well. And we'll help you post it all over social media. What's unique about HealFunder is that we verify the diagnosis, and we also verify that the money raised is actually paying the medical bills. So that's different compared to other crowdfunding platforms. And this, we hope, will reduce or eliminate the chances of fraud. And we don't care what kind of medical expenses you want to fundraise for, whether it's something that's necessary or whether it's a cosmetic procedure. It could be orthodontia for your children, or it could be sex reassignment surgery. We will not discriminate against you. Going back to the Patient Savings tab, under Heal Funder, you'll see we have a directory of discounted imaging services. We currently have about 2,500 centers participating in this program. The average savings are between 50 and 75% off the cash price of an MRI or CAT scan. There are eligibility requirements, and if you're interested in learning more about this program, you could either call this number, 888-693-8867, or you can click here and begin the application process online. And going back to the Patient Savings tab, the last resource I'll point out is the medical bill mediation service. If you or your patient has incurred $1,000 or more in unpaid medical bills, this may be of interest to you. This medical bill mediation service will charge you an upfront fee of $200, and for that fee, they will work on your behalf to negotiate your bills down with the billers. And they say that the average savings is more than 30% off the bill, and sometimes even more than 50% off the total bill. But they do, like I said, charge a $200 fee up front, and you'll have to weigh the pros and cons of that. If, for example, you had to stay in the hospital when you did not have health insurance and it cost you thousands of dollars, this may be an option for you. If you're interested in learning more about this, feel free to call NeedyMeds at our 800 number. So, excuse me. The last way you can save money with NeedyMeds is to use our drug discount card. And this is what it looks like, and I'll point it out to you on the home page in just a moment. But what's important to know about the drug discount card is that you can save between 0, meaning nothing, and 80% off the cash price of an over-the-counter medicine or supply if it's written as a prescription medication, or a pet prescription if you're buying it at the People Pharmacy. And this card can only be used at a brick-and-mortar pharmacy. It cannot be used for online purchases. Last month, the card saved consumers nearly $4.5 million. And it's used between 80 and 85% of the time it's presented to the pharmacists. So that's how we know that the card is working and actually saving people money, because they're using it more often than they're not using it when they check a price at the pharmacy. How does the card work? Well, pharmaceutical manufacturers will negotiate discounts with the pharmacies through the aid of an adjudicator. And in this case, the adjudicator is a company called Argus. And the discounts are renegotiated frequently. They vary from month to month and even from pharmacy to pharmacy. And they may even vary from one CVS to another CVS. So we always encourage people to try the card each time they have to make a purchase at the pharmacy. There are no eligibility requirements. There's no registration. There's no activation of the card. And there's no application. There are a lot of drug discount cards out there besides NeedyMeds. So what's different about the NeedyMeds card? Well, first of all, it's always free to use and it's always free to obtain. We will never charge you to get the card, and we will never charge you to use the card. Some of the other cards out there actually will charge you to get the card, and then each time you use the card, you'll incur a small transaction fee. But that's not the case with the NeedyMeds card. Also, we do not collect any identifiable information about our users, so it's totally anonymous. We're not collecting your names, and so we're not selling your names and what you're purchasing to third-party marketers. We only track the dollar amount of savings and the number of times the card is used each month. And third, because we are a nonprofit, we're not trying to maximize our own profit with this card, which allows us to pass on the greatest savings to the consumer. So we, NeedyMeds, will collect a small transaction fee each time someone uses one of our cards. But this small fee helps us with the administration of the card and our website. And as I mentioned, the card is always free to the users. Our card never expires, and you can share one card among a whole family. All you have to do is bring your card and your valid prescription to the pharmacy. It's currently accepted at over 63,000 pharmacies across the country, and that includes all the major chains and many of the smaller ones as well too now. And if you ever have trouble using the card, on the back of each card is a toll-free helpline that connects you to Argus, the adjudicator of the card. So if a pharmacist has a question or concern or says that you have to use your insurance, you can't use the card, you can always call Argus and they will clarify to the pharmacist that the pharmacist has to accept your card. Who can use the card? Literally anyone can use our card. The only rule is that it cannot be combined with health insurance. So if you are uninsured, of course you can use the card anytime. And if you have public or private health insurance, you can use this card instead of your insurance. If, for example, your medication is not covered on your plan, or the copayment or deductible are too high, or you find yourself in a coverage gap like the Medicare Part D donut hole, you can use this card because you're paying, you would use this as off the cash price. So if you're using this for Medicare Part D, keep in mind that it's the same as paying cash and therefore won't count toward getting you out of the donut hole. I hope I said that clearly. So if you have insurance, you can use the card instead of your insurance. It's always your right to choose that. But if you're in the Medicare Part D donut hole, it will not count toward getting you out of the donut hole. And I also want to mention that because we're not collecting any names or any information about the users of this card, we hope that it fills a gap. So that where someone might not be eligible for a PAP or a diagnosis-based assistance program because of their insurance coverage or their income level or perhaps even their citizenship status, anyone can use this card. And so in that way, we hope to fill a gap and offer yet another way that people might save money on their healthcare expenses. How can you get your NeedyMeds drug discount card? Very easily, and I'll point this out to you in just a moment on the website. You can print one off the website, and the paper card is just as good as a plastic card. You can send a self-addressed stamped envelope, and we'll mail you a plastic card if you prefer that. If you work for an organization, a business, a government center, a healthcare facility, a doctor's office, or a hospital, you can request a free supply of cards for your patients. And there's never any charge for these cards. You can order as many as you like. We'll include brochures, which come in various languages, which explain NeedyMeds and how to use our website. And if you are an organization, we will customize the cards with your name and logo on them, and there's no charge for that if you don't mind that they're printed in black and white. Color printing is more expensive, and so there would be a charge for a color logo. But if you don't mind a black and white logo, we're happy to print that for free for you so that instead of saying NeedyMeds, they'll say the name of your organization. So there are 3 tools that I want to point out to you on the website in just a moment. We have a drug pricing calculator, which will allow you to compare the discount you'd receive with the NeedyMeds drug discount card at various pharmacies in your area. We have a pharmacy finder, which tells you which pharmacies accept the card. And we have a drug discount card app that you can download for smartphones. And if you're an organization, we can custom make one with your name and logo on it. I'll also show you on the website how you can print off a paper version for yourself or for your patients. And also, I'll point out the customer support number for Argus. So going back to the NeedyMeds website, here's the home page. If you double click the picture of the NeedyMeds drug discount card, sorry, it's a little slow. Let's see. There we go. So if you double click the picture of the drug discount card, it'll take you to the drug discount card page. You can print one by clicking on this link. It will take you to a downloadable PDF of the card, and you can have a paper copy of the card immediately. You can fill out this form, and we'll mail you a plastic card. Or you can send a self-addressed stamped envelope to this address, and we'll mail you a plastic card. If you want to see which pharmacies are currently accepting the card, you can type in the name, the address of the pharmacy here, and it'll pull up a directory of all the cards in your area. Any pharmacy that's listed in this pharmacy search is legally contracted to accept the NeedyMeds drug discount card. They have to accept the card, and sometimes a pharmacist may not know that they have to accept the card. And if you find yourself, as I said, with a pharmacist who's not knowledgeable about this, simply call the number on the back of the card, which will direct you to Argus, the adjudicator, and Argus will speak with the pharmacist and clarify the situation. So again, any pharmacy listed in this directory is contracted to accept our card. Here's the drug pricing calculator I mentioned right here. It's right at the top of the home page. If I click on search and then I click price calculator, this will take you to Argus's website. This is where you're going to find an estimate of what you would pay on a particular day for your medication. So you would select the name of your medication. You could select up to 5 pharmacies in your zip code. You would plug in the quantity that you're seeking, and then you would select price. And over here on the right-hand side, it would create a table with the name of your medication, the location of the pharmacy, and the estimate that you would pay on that day at that particular pharmacy. And again, these prices change from day to day, and it's just an estimate. It may be a few dollars, give or take. And I found that by going to the NeedyMeds homepage and then clicking on Drug Pricing Calculator. So those are the tools. And if you wanted to have the smartphone for your app, you could click here and download the app for your phone. Right here. Here's the smartphone app. And again, if you are an organization, we can design a smartphone app for your website with your company's name and logo on it. So if you're an advocate, I just wanted to point out that we have a few resources that may be of interest to you if you work with patients and you help patients apply to these programs. PAPIS is Patient Assistance Program Update Service. It's a free service that we will provide to you. You can opt to receive weekly or daily email alerts every time NeedyMeds makes a change or updates a PAP on our website. You'll know about that change if you sign up for PAPIS. So you can opt for daily or weekly alerts. PAP Tracker is software that we offer to organizations. If you're a nonprofit, we currently have a grant program that you may be eligible for. PAP Tracker is software that streamlines the application process for applying to these programs. If you have one patient who needs 5 different medications on PAPs, you can imagine how time-consuming and laborious it would be to complete 5 applications by hand. Whereas PAP Tracker allows you to put the patient's information into the software once, and then you generate the 5 different applications automatically. It also helps you to keep track of renewals and when it's time to reapply. It helps you track where the order is and when the order ships and so on. And it also helps you generate convenient reports, especially if you have to report to funders. You can generate detailed reports about the dollar amount that you're saving patients by helping them apply to these programs and so on. So you can contact me if you'd like further information about PAP Tracker. If you want to order brochures, feel free to do so. Here you can order them in English, Spanish, Portuguese, Russian, and we also have a Cambodian brochure that can be downloaded. Here you'll see Patient Assistance Resource Education, which is a course very similar to this webinar, except it targets healthcare professionals and patient advocates. And people who complete this course at the end and pass the exam receive a certificate of completion. There's a small fee for that, but if that's a hardship for your organization or healthcare facility, we can negotiate that fee. I think it's $15 per student, but if that's a hardship for you, we'll totally work with you. Patient Advocate Newsletter is a monthly newsletter where I try to provide tips for advocates and also tips that could be relevant to patients as well. So it's not just for advocates necessarily. But I try to focus on things that are new at NeedyMeds and resources that most people don't know about and things of that nature. We also have a volunteer project that comes with a free manual and ongoing technical guidance and support from yours truly to help you start a volunteer program to train volunteers to help people apply to PAP programs. If your staff doesn't have time to do it, perhaps you'd like to start a volunteer program at your organization or healthcare facility. And if you're interested in becoming an ambassador for NeedyMeds, our volunteer ambassador program will gladly accept any time you would be willing to give us. An ambassador might represent NeedyMeds in their own local community by giving a brief talk about NeedyMeds at their local library or PTA meeting or civics meeting. It also might mean representing NeedyMeds at a local health fair or a conference and perhaps sitting at a table and handing out NeedyMeds brochures. If you're interested in that, I'll provide my contact information as well. So with that, let me go back to the presentation and here is where you can find my email address. It's Lori@NeedyMeds.org. If you want information on any of the programs I just mentioned to you, if you need any guidance or support going forward, if you have any questions about what we've discussed today, feel free to email me. If you want to order a supply of drug discount cards for yourself or for your patients, or if you want any brochures, please email my colleague Deb at NeedyMeds.org, and she would even be happy to help you design a customized card with your organization's name and logo. If you or your patients need help navigating the website or finding a patient assistance program for something that you don't see on our website, please call our toll-free helpline. Our operators are ready and willing and happy to help you navigate the website, or if you don't even have internet access, or your patients don't have internet access, all operators will do the looking for them. Call our toll-free helpline Monday through Friday, 9 to 5 Eastern Time, and let us help you. So with that, I will take any questions that you currently have. So if you'll just give me a moment, I'll start reading through the questions. So this question is, how often do we update the contact information on the clinics and the dental assistants? We have a research team dedicated to keeping the website up to date. In fact, most of the people on staff at NeedyMeds are researchers. And so depending on which database we're talking about, whether it's the clinics or the diagnosis-based assistants or the PAPs, it varies in terms of how often they're updated. Some of them are updated monthly, some of them every 2 or 3 months, and some of them every 6 months. If you know of something that's not up to date on the website, please do send us an email so that we can correct that. But we do try to be as up to date and comprehensive as possible. This is a question about the medical bill mediation program. The question is, does the bill need to be one single bill, or can it be combined bills that add up to the amount stated? I believe it can be a number of bills that add up to $1,000 or more, but that would be a question that would be best posed to the NeedyMeds operators, and that number is provided on the website, as well as here, the toll-free helpline. You could get that information from the toll-free helpline. But I believe it's a combined total of $1,000 or more. This question is, can the coupons and drug discount card be combined with Medicare and government prescription insurance programs? No. Coupons and the drug discount card cannot be combined with any other insurance. They're used when you pay the cash price of a medicine or over-the-counter medicine or supply. So no, it cannot be combined with insurance. This is a question about the drug discount card and over-the-counter supplements. Um, so the question is, can the cards help with over-the-counter supplements that are prescribed by a naturopath if you're purchasing the supplies at a pharmacy? It has to be a valid prescription, and I believe that pharmacies currently only consider prescriptions from physicians, physician's assistants, nurse practitioners, and so on as valid prescribers. But you can double check by calling the pharmacy in question. But I don't believe that a naturopath's prescription would be considered a valid prescription at a pharmacy. But again, you could go to, your primary care physician if you do have one and just simply ask them for a prescription for whatever you need. Uh, you know, some patients will get an over-the-counter prescription, will get their doctor to write a prescription for over-the-counter supplies like Depends undergarments or diabetic testing strips, or even over-the-counter medicines like aspirin if the patient takes aspirin every day. So these are just little ways that a patient might save on their overall healthcare costs. So coupons, this is a question about coupons. Coupons can be used if you're paying the cash price. And if you are if you have Medicare Part D, using a coupon means that you're paying the cash price and getting a discount off that cash price. So yes, you can choose to do that, but as I said, it will not work toward getting you out of the donut hole if that's where you're at. And the question, how much does it cost to get an app designed with your organization's logo? Usually, if you're a nonprofit organization, usually it's free if it's black and white. This is a question, if you wouldn't mind emailing me the name and contact information for your organization, and then I can connect you with someone on staff who can talk about that with you. But again, if you wanted plastic cards, there's never a charge for that. So the question is, why do pharmacies agree to participate in the drug discount card programs? So yeah, there are a lot of drug discount cards out there in addition to the NeedyMeds one, and they all work the same. And the question is, why would a pharmacy agree to a discount? And the question is because they're still making money. Because if you're getting a discount on a medicine, they're still making more money than they would if you didn't get that medicine at all because you couldn't afford it. And also, if you're going into a pharmacy to use your drug discount card and save on a particular medicine, you're still walking through the aisles, and perhaps you notice that you're out of Q-tips, or you're out of floss, and you're out of toothpaste, and you're picking up other things as you're walking through the aisles. There's a reason why the pharmacy is at the back of the pharmacy, and all of the other products are in the front of the pharmacy. It's because they know you're going to do other shopping while you're in there waiting for your prescription to be filled. So they're still making money. And also, all of the other pharmacies are participating, and it wouldn't help them establish customer loyalty if they were the only pharmacy in the neighborhood who was not participating in the program. And so for all these reasons, pharmacies are incentivized to participate in drug discount card programs because they're still making money even with the discounts. Let's see. Can you use a coupon and the drug discount card for the same prescription at the pharmacy? No, it's usually one or the other, but you can certainly ask the pharmacist to tell you how much you would save with the drug discount card and then compare that to your coupon or even your own health insurance if you have health insurance. You can always ask the pharmacist to compare the drug discount card to your own insurance if you have it. More often than not, your co-payment's probably going to be cheaper than what you get with a discount off the cash price with our card. But occasionally it does happen where the cash price is less than or the same as what you'd pay with your copay. Any other questions at this time? Okay, well, thank you so much for your attention today. I hope this was helpful. Again, if you have any further questions that I didn't get to, please email Lori at NeedyMeds. If you have questions about ordering drug discount cards or how to customize them, please contact Deb at NeedyMeds.org. And if you or your patients need help looking for assistance programs, please call our toll-free helpline. We're happy to help you. And again, we're always looking for feedback and suggestions. Our website is a work in progress. If you can think of any information that's not currently on the website but you think would be helpful, let us know. We appreciate your suggestions. So the next overview webinar, which will be very similar to this one, will take place April 22nd at 2 o'clock. You can register for that by going on the calendar on the homepage. And again, this webinar will appear on our webinar library page in a week. And you would find that by going to the Getting Started tab on the homepage. You'll see Getting Started in the blue banner. Click on that, and then you'll see Webinar Library, and you'll see our old webinars as well. So until next time, we wish you good health and happy days. Thank you so much.